Hey everyone, this is Matt again, and I'm with Tom of Core Physical Therapy. Uh, we're going to be talking about shoulder impingement today, and if you're a Body by Brady member, remember Tom will be here Saturday from at 10:20 to talk to you guys more about shoulder issues and other stuff, and how you guys can work around those issues. So I guess to start off today, what is shoulder impingement?
Shoulder impingement is basically pain in your shoulder. Impingement is a pinching.
Okay.
So you have a bursa sac and you have a couple other tendons and muscles, and
Okay.
everything gets pinched. So typically it's with any type of reaching up overhead or any type of forward posture like that causes
Okay.
pain.
What usually causes it?
A variety of things. One of the things is poor posture. So as I'm leaning forward,
Okay.
you see how my shoulder blade tends to wing out
Yeah.
and tilt forward. So if I raise my arm up in that position, really there's a disconnect or dissociation between my glenohumeral joint in my shoulder and my scapula back here.
Okay.
So that whole position is all pinching.
Okay.
Whenever you move your shoulder, there should be a good timing, a proper sequence of events where initially your rotator cuff's going to actually pull that bone down to clear the joint. And as you raise up, your scapula or your shoulder blade should be rotating with it. And then at the very end, your clavicle or your collarbone flips and rotates up in order to really clear that area. If I'm in that posture here, hunch forward, and I come up, it's not going to go past that.
Yeah.
It doesn't feel very good. Just by correcting that posture, getting your shoulder down and back, now you're able to clear that joint really without any issues or pinching.
Okay. So if someone thinks they have shoulder impingement, is there a certain way you're going to be able to tell just by feel, or how would someone listening to hear know if it's just shoulder issue, rotator issue?
Yeah, there's a couple special tests to the shoulder, and any one test is pretty indicative, but really what you want is 2 or 3 positive tests.
Okay.
So there's a couple different tests for positive impingement. One, Hawkins-Kennedy, where you're trying to rotate the shoulder down, and really any pinching that you feel is a positive test. And then NIRS, which would be passively raising that shoulder up overhead, and again, pain is a positive test finding.
So I'm sure this is right in your wheelhouse for what you can help people with. What are, different ways that you can help people with shoulder impingement?
Yeah, so there's a few different techniques and treatments. One of the things for your shoulder, it's a golf ball on a tee. So it sits flush like that. And with a lot of people, with that forward posture, your posterior capsule in the back of your shoulder is actually pushing that bone forward. So it doesn't always sit flush. So right away, you're at a disadvantage because you're automatically pinching everything in the front through here.
Yeah.
So through several different PT techniques, or really exercise strengthening techniques, one of them is going to be mobilizations, just trying to get rid of pain, move the shoulder around a little bit. Again, it's a roll and slide. So every time you raise your arm up, that shoulder joint rolls and slides back. Whenever you bring it down, out to the side. And with pain, muscles stop working and you get inflammation and things hurt.
Okay.
So everything just gets tight. So you can stretch the capsule out, especially that posterior capsule, through different mobilizations. And then just working on stretching and strengthening, really.
Okay. So do you use a lot of band work when you do that? Do you use a lot of dumbbells, manual,
a lot of it,
pushing people through?
Yeah, that's actually one of my favorite things, is doing a lot of hands-on stuff. So we'll start with mobilizations, do passive range of motion, stretching, really in all different angles, because it is a ball and socket joint. You have so much mobility, and it's just a matter of encouraging that mobility to keep on happening and being able to keep moving. And then I like manual resistance, so I'll do a lot of scapulothoracic stuff where it's manually trying to resist someone bringing their shoulder up or bringing it forward and back, just to really get the timing and the sequence down. Because if there's that disconnect between your shoulder and your shoulder blade, you can do all the band work you want, but at the end of the day, if you're still raising your arm up and that shoulder blade is stuck or not moving, it's going to continuously result in that pinching.
So say someone doesn't fix their shoulder impingement, can that lead to other issues, or what kind of ramifications are there if you just try to push through the pain?
Yeah, over time it can lead to some rotator cuff issues. So a lot of people, they might say rotary cuff, but rotary cuff, but rotator cuff. And a lot of it too is based upon how you're born. So people have different types of acromions. They're either curved, hooked, or beaked. And based upon that and that posture, you can actually pinch down on your rotator cuff a little bit and start to get a little bit of a strain or even a tear every time that continuously keeps happening. And then you get a little bit of a bone spurt, and then that bone spurt pushes further deep into the soft tissue, which leads to more pain. Eventually that's when they come in, typically with a surgery, and they'll do subacromial decompression, which is they'll shave the bone down. If your bicep tendon's affected, they might move your bicep tendon, just clean up any type of arthritis, which anytime you don't need to have surgery, you can avoid surgery, that's always ideal.
Definitely. So if someone was thinking about coming to you, or I know it's probably on a case-by-case basis, how long do you usually have to work with someone with shoulder impingement to start seeing results? I know it probably involves homework for them.
Yeah, fairly quickly though. You'd be surprised. A lot of it's just that postural education and just a ton of education as soon as they walk through the door to realize if I'm in this posture here and if I'm working out and I just keep on jamming that shoulder, well, everything I'm doing is just causing it to stay irritated and get worse. So all of a sudden, just by clearing that joint, now you have room to have everything move. And really your goal is you want to have the stability in your shoulder blade to allow for mobility in the shoulder. If you're unable to remain stable in the back, you really don't have the ability to be mobile throughout your shoulder.
So if someone's listening to it now, what are some, easy ways, 4 or 5 quick things people can do from home to kind of help avoid this problem or be preventative with it?
One of my favorite things is foam rolling your thoracic spine. So you can just get on the ground, have the foam roll perpendicular, and you just go up and down and really try to you might get a couple pops through here, but you want to promote thoracic extension. You want that ability to get down and back. And again, going back to the stability and mobility component, if your thoracic spine is mobile, it allows for that shoulder blade to be a little bit more stable, which then is going to also allow for more mobility in the shoulder. So just by getting that thoracic spine moving, that's going to help. Several different stretches for behind the shoulder, the towel stretch behind your back, where you're literally just holding the towel, pulling up.
Now you're trying to drive yourself, but you're
pulling up through here, trying to get a good stretch. Or they have sleeper stretch on your side. And really, I wouldn't do this stuff unless you know what the issue is, because it could be potentially making something worse. But if it is impingement, those are 2 stretches that really seem to help. Doing a nice pec stretch in the doorway, that helps a lot as well.
If you missed our posture video, go back and watch our posture video. So working on your posture, I'm sure would help with this.
Just promoting like middle trap, lower trap. So you're doing your rows, anterior stratus, so your supine punch, or really any type of punching motion where you're getting that scapular control. And then just promoting more rotator cuff exercises where you're really keeping that shoulder down and back.
Awesome. We have a bunch of Body by Brady people actually watching this. Can you give a quick 20, 30-second preview of what they can expect on Saturday?
Yeah, so on Saturday we're going to have the workshop. It's basically just going to be a lot of education, or a lot of explanation, some anatomy lessons. But then at the end of the day, it's just going to be a little bit of demonstration, and you guys can play along as far as doing some of the stretches and exercises. And I like doing things the right way and then the wrong way, so you can feel how it shouldn't be done. And then the right way again, because we really want to encourage that muscle memory and really work on getting good posture, good practice. So just basic exercises, some of my go-to warm-up techniques, and just some of my favorite strengthening exercises.
Awesome. And we'll probably be doing a video soon on your new golf program, and be on the lookout for that. He's not going to teach you how to play golf. He's going to try to improve, or I guess, your swing, or
so it's the TPI, so it's Titleist Performance Institute, and got certified in that last year. And like you said, I'm not qualified, nor should I be coaching a golf swing. But what I can do is I can look at everybody's mobility in their body, their shoulders, their hips, look at stability, look at balance. And a lot of times there's a high correlation to having poor swing due to faulty mechanics. So if I lack shoulder mobility and I can't go past here, most likely I'm going to have a flat golf swing. If I lack hip mobility, I'm going to have slider sway throughout that the swing, and just leads to pain, dysfunction, and really an inability to maximize your body to hit the golf ball as far as you can.
Awesome. So if you guys have any other questions about the shoulder or anything like that, post in this comment section, and I'll get them over to Tom to where he can answer these, or he'll have Lindsay get on here and answer the questions for you. We already have, if you click on Core Physical Therapy on the top in the description, you'll be able to find a link to their Facebook page, to where if you want to book a consult with Tom, if you have any issues, you can go and check that out for you guys. Don't forget to like and share this post. Anyone you know that might have a shoulder issue or any kind of other issue, don't forget to let them know, watch this video or send them over to Tom. And we'll see Tom on Saturday. Thanks for coming by.
Thanks for having me.